Are there any hospitals left in Gaza? The ongoing conflict in Gaza has caused an unprecedented collapse of its healthcare system, leaving only a small number of medical facilities still able to serve the population. These remaining institutions operate under constant threat from bombardments, limited power, and extreme resource depletion. Doctors and nurses work around the clock, often enduring sleepless nights and overwhelming patient loads that test their emotional and physical capacities. The situation is made worse by a scarcity of essential medications, clean water, and adequate fuel supplies, all of which are vital for running generators and life-saving equipment. Civilians seek treatment for injuries, chronic illnesses, and urgent maternity care amid damaged buildings and frequent power outages. This volatile setting, with unpredictable escalations in violence and pervasive fear, has created an alarming environment for both patients and medical professionals. Most of Gaza's health workers remain at their posts, despite imminent dangers. They arrive each day uncertain whether there will be enough supplies to treat those in need, or if the facility itself will still be standing. Even as international organizations call for ceasefires, humanitarian corridors, and protection of medical personnel, access to essential assistance is repeatedly delayed or obstructed. The humanitarian crisis intensifies with each passing day, and the toll on public health becomes more severe. This situation underscores the urgent need for global intervention to protect healthcare infrastructure, support exhausted frontline workers, and enable the safe delivery of humanitarian aid. Gaza hospital status. Hospitals in Gaza are now functioning at a fraction of their previous capacity. Many facilities have been damaged or destroyed, reducing the total number of operational hospitals and leaving large sections of the population with nowhere to go for urgent treatment. In northern Gaza, those hospitals that remain are overwhelmed by the massive influx of injured and ill people, most of whom have traveled long distances while under severe duress. Families set up makeshift sleeping areas in every available corner of buildings that still stand, hoping to find both treatment and shelter. Without consistent power and clean running water, day-to-day operations become a Herculean challenge for staff. Some units have ceased functioning entirely, including areas once devoted to chronic disease management and specialized surgeries. Meanwhile, the slow trickle of aid fails to address the magnitude of shortages in medical supplies. Conditions are similarly dire in the southern regions of Gaza, where conflict has forced many families to flee from the north. The partial functioning of some smaller medical outposts provides a limited safety net, but the overall strain on resources remains immense. Medical directors have spoken of a stark reality in which there is little room for new patients. While those in need of advanced surgeries must be turned away or placed on waiting lists that only grow longer, many pregnant women are forced to endure dangerous delays. The few operational hospitals that attempt to accommodate them find that even basic equipment is running on borrowed time, sustained by rapidly diminishing fuel supplies. Despite all this, dedicated teams continue to do what they can for those seeking treatment. The Kamal Adwan Hospital raid. The Kamal Adwan Hospital, the last major functioning healthcare facility in northern Gaza, was rendered inoperable after a raid by Israeli forces on December 29, 2024. The raid forced the rapid evacuation of all patients, staff, and displaced civilians, who had been given a mere 15 minutes to gather their belongings. Critically ill individuals on ventilators and those in comas were hurriedly transferred to already overwhelmed facilities like the Indonesian Hospital and Al-Shifa Hospital in Gaza City. Entire wards sustained severe damage, and parts of the hospital were reportedly set on fire, erasing any hope of restoring services in the near future. The hospital's director, Dr. Husam Abu Safia, was detained amid allegations of using the facility for military purposes. Observers on the ground stated that no evidence was presented to support these claims, and international organizations have called for his immediate release. With Kamal Adwan Hospital now closed, about 75,000 Palestinians in northern Gaza have been left without any lifeline for urgent medical care. The forced relocation of vulnerable patients adds to the mounting humanitarian crisis, as the remaining hospitals are ill-equipped to absorb new influxes. Human rights advocates have denounced this escalation, describing it as another blow to Gaza's collapsing healthcare system. Dire working environment. Medical personnel in Gaza are forced to operate in settings that defy basic standards of safety and hygiene. Hospitals originally designed to handle routine patient loads are now overcrowded and frequently used as makeshift shelters. Injured civilians line hallways, waiting for a chance to see any available doctor. In some cases, electricity fails during life-or-death procedures, forcing teams to continue by flashlight or any other light source they can find. Surgeries may go on without the appropriate anesthesia or sterile equipment, increasing the risks to both patients and staff. The lack of reliable sanitation services elevates the likelihood of infection, and contaminated hospital environments can transform once manageable wounds into life-threatening conditions. These extreme circumstances create a breeding ground for further psychological strain. Medical professionals are acutely aware of the threats lurking within the very facilities they strive to protect. Shelling can damage roofs, roads, and even entire wings of hospitals, leaving staff exposed to direct harm. This turmoil disrupts every aspect of patient care, forcing decisions that no practitioner should ever face. Should a procedure be completed in a compromised operating theatre, or should staff wait for a safer environment that might never come? These impossible choices occur daily, revealing the relentless and unsustainable nature of the current situation. Healthcare workers' sacrifices. Many doctors, nurses, and volunteer aides in Gaza have suffered profound personal losses. Some have lost homes or close relatives to the escalating violence, yet they still report to their posts every day. Their grief is carried silently as they move from patient to patient, directing their energy toward those who need immediate relief. For some, this devotion to duty acts as a coping mechanism, providing focus amidst a backdrop of constant grief and instability. For others, it brings an acute sense of conflict when they must weigh personal safety against the urgent call to save lives. In the most tragic instances, a healthcare worker arrives on shift only to discover that a friend or family member is among the wounded. Through it all, many refuse to leave, even when advised to seek safer locations. Their sense of solidarity and commitment to the community keeps them bound to the wards, operating rooms, and shelters that desperately need medical expertise. They cling to hope that an end to hostilities will arrive soon, allowing them to reunite with loved ones and begin the process of healing from unimaginable trauma. Their unwavering presence has become a beacon for those who rely on their care, demonstrating that compassion and courage can endure even under the harshest conditions. Healthcare worker casualties. One of the most disturbing aspects of the crisis in Gaza is the rising number of healthcare worker casualties. Medics have been hit by stray shells or targeted during ambulance runs. Others have died under the rubble of hospital buildings that have come under heavy fire. These incidents have drastically reduced an already overburdened staff. The loss of skilled professionals means that some departments are left without specialists who can perform critical procedures. The resulting gaps in expertise place extra strain on remaining personnel, who must extend themselves into areas of medicine outside their usual competence. The risk is not confined to direct attacks. Many are exposed to threats on their way to or from the hospitals, making every commute a perilous journey. Several medical professionals have vanished after venturing into contested areas, leaving colleagues to fear the worst. These realities make every medical shift feel like a gamble with life. The departure or death of a single experienced surgeon can spell catastrophe for a hospital struggling to maintain vital services for thousands of patients. In this climate, the moral and ethical weight on the shoulders of those who remain grows heavier, as they continue working with the knowledge that they might be the next to fall victim to violence. Humanitarian crisis escalation. As the healthcare system collapses under the pressure of ongoing hostilities, the broader humanitarian crisis deepens across Gaza. Disruption to medical services has led to a dangerous surge in preventable conditions and a spike in deaths from treatable ailments. Children and pregnant women are particularly vulnerable, as maternity wards struggle to cope with the constant demands of prenatal care, neonatal support, and deliveries. Chronic disease patients face increased complications because routine treatments and regular checkups are no longer reliably available. Malnutrition is on the rise due to disruptions in food supply chains, while unsanitary conditions create prime opportunities for the spread of infectious diseases. This dire environment contributes to a chain reaction that extends beyond hospital walls. The destruction of basic infrastructure, such as water treatment plants, has led to severe shortages of clean water, making illness and injury far more difficult to manage. Health professionals note that the mental toll on families living in these conditions can be overwhelming, adding another layer of complication to an already distressed community. Many international agencies warn that if immediate relief measures are not implemented, the crisis will become increasingly irreversible. The long-term well-being of Gaza's population hangs in the balance, with experts stressing that the current situation requires not just temporary fixes, but a fundamental reimagining of healthcare and humanitarian support in the region. Long-term health consequences: the destruction of Gaza's healthcare infrastructure and the disruption of essential services pose grave long-term risks for public health in the region. Even if a ceasefire were declared tomorrow, it would take years to reconstruct the facilities and restore a stable network of clinics, specialty wards, and emergency units. The backlog of untreated chronic and acute conditions will likely contribute to higher mortality rates in the coming months. Outbreaks of preventable diseases could escalate, given that vaccination campaigns and routine checkups have been heavily compromised. Childhood malnutrition may rise sharply, with lasting effects on health, cognitive development, and overall well-being. This crisis also causes a ripple effect on neighboring regions, as displaced populations move in search of medical care or safer housing. Over time, the strains on medical staff could deepen, especially if a significant portion of those trained professionals decide to leave or are unable to continue in the face of repeated trauma. Economic recovery will be hindered by a population burdened with poor health, and civic unrest may escalate if people view the humanitarian crisis as being ignored by the global community. Thus, the well-being of Gaza's future generations is intimately tied to the actions taken right now to rebuild and reinforce a healthcare system on the brink. Systematic destruction strategy. Reports suggest a pattern of deliberate actions aimed at crippling Gaza's healthcare framework and vital infrastructure. Many observers argue that recurrent strikes on hospitals, clinics, and ambulances cannot be dismissed as isolated incidents. The widespread damage to power plants, water supplies, and transportation routes further compounds the crisis, leaving little doubt that the intent is to make daily life nearly impossible. Local authorities describe a landscape of devastation, where once bustling urban centres are now partially deserted due to fear and lack of basic services. The resultant atmosphere fosters the displacement of communities, who then struggle to survive in overcrowded temporary shelters with minimal medical assistance. Such systematic destruction also fuels assertions that the situation in Gaza transcends mere military conflict. The dismantling of fundamental institutions makes it exceedingly difficult for residents to return to normalcy, ensuring that they remain in a state of crisis. Under these conditions, efforts to coordinate relief, distribute resources, or plan reconstruction fall short. Many experts warn that unless these strategies of destruction end, the region's healthcare system and essential public infrastructure could be rendered non-functional for generations. Evidence supporting ethnic cleansing. As entire neighborhoods are reduced to rubble and basic healthcare facilities cease to exist, some human rights organizations claim that these events indicate an orchestrated effort to forcibly remove Gaza's population. The argument centers on the systematic nature of attacks against civilian infrastructure, which makes it nearly impossible for families to remain in or return to certain areas. Hospitals that once served as community pillars now stand in ruins or are too damaged to operate at full capacity, effectively stripping residents of vital support. Forced displacement occurs when people realize that there is no longer any form of protection, medical or otherwise, that can guarantee their survival in their homes. Additionally, statements from Israeli officials and public figures advocating for the relocation and expulsion of local populations bolster these assertions of ethnic cleansing. The logic, critics argue, is that by destroying healthcare services, water supplies, and other civilian structures, a region becomes unlivable. Families then have little choice but to flee to places where they hope to find greater stability. These actions, taken together, shape a narrative that points to a deliberate aim of removing or replacing a population through systematic devastation. While definitive legal rulings are seldom swift or unanimous, the mounting evidence calls for deeper scrutiny and legal accountability for all responsible parties. Legal and ethical ramifications. The relentless attacks on hospitals and healthcare workers raise grave legal and ethical questions. Under the foundational principles of international humanitarian law, medical facilities are granted special protection during times of conflict. The repeated destruction of these sanctuaries stands in stark contrast to global norms and constitutes serious violations that warrant investigation and accusations for war crimes. Yet legal processes often move slowly, and the absence of robust enforcement mechanisms means that perpetrators can sometimes act with impunity. Human rights organizations are urging global bodies to intervene more decisively, arguing that the current approach is inadequate for preventing or punishing wrongdoing. For the international community, the crisis in Gaza underscores the potential fragility of long-established ethical frameworks. When medical neutrality is routinely violated and no immediate repercussions follow, it sends a troubling message that these universal standards can be ignored. Many observers warn that failing to address these legal and ethical breaches will erode confidence in the international system meant to safeguard civilians and preserve fundamental human rights. International law enforcement. While multiple treaties and conventions explicitly protect medical facilities and personnel, the challenge lies in ensuring these laws are effectively upheld. Bodies like the United Nations can pass resolutions condemning attacks, yet such statements often lack binding force or clear pathways for enforcement. The International Criminal Court can investigate potential war crimes, but jurisdictional and political hurdles frequently delay or limit meaningful action. Additionally, diplomatic pressures, sanctions, and naming and shaming campaigns can momentarily draw global attention, but the persistence of violence in Gaza and other conflict zones demonstrates the gap between international principles and practical outcomes. Civil society groups play a pivotal role in documenting violations, gathering eyewitness accounts, and compiling data for legal proceedings. Their efforts bring awareness to issues that might otherwise be hidden behind the fog of war. Yet without swift and consistent responses at an international level, these documentations serve primarily as historical records rather than catalysts for immediate change. This tension highlights a recurring shortcoming in the global order, where moral condemnation does not necessarily translate into concrete protective measures. In Gaza, as in other conflict regions, the fate of hospitals and medical staff thus rests on a fragile lattice of weak enforcement and tenuous diplomatic agreements.